A syndesmosis injury, or a high ankle sprain, is an injury that occurs when there is a splaying of the distal tibiofibular joint. This generally occurs because the talus is forced up towards the tibia and fibula, causing the bones to splay. This causes damage to the structures of the syndesmosis, the anterior inferior tibiofibular ligament, the posterior inferior tibiofibular ligament, and the interosseous ligament. These structures are meant to limit lateral displacement of the fibula from the fibular groove on the tibia. There are three ranges of motion that can constitute the mechanism of injury for a syndesmosis sprain. These are external rotation of the foot, excessive dorsiflexion, and eversion of the talus. For this tape job, you will need Hypafix, 2-inch Leukotape, and pre-tape spray. Before beginning any tape job, it is essential to prepare the area accordingly. Ensure the skin is dry and free from any lotions. Check skin for deformity, contusions, abrasions, penetrations, burns, tenderness, laceration, and swelling. Then, check for movement, sensation, and capillary refill distal to the taping site. Finally, pre-tape spray can be applied to make the area tacky and allow for better tape adhesion. Have the athlete sit on a table with their leg extended and their lower leg hanging off the edge. Their foot should be relaxed and in a neutral position. Apply Hypafix to the lower leg just above the malleoli. The Hypafix should be long enough to cover from the posterior aspect of the lateral malleoli to the posterior aspect of the medial malleoli and wide enough to fit 2 to 3 strips of 2-inch Leukotape. Using Leukotape, cut one strip that is long enough to begin at the posterior aspect of the lateral malleoli and reach approximately the posterior aspect of the medial malleoli. Lay down the strip beginning at the posterior aspect of the lateral malleoli, adhering the strip only to the midpoint of the shin, then folding the piece back towards the lateral side. Cut another strip that is long enough to begin at the posterior aspect of the medial malleoli and reach approximately the most anterior aspect of the lateral malleoli. Lay down this strip beginning at the posterior aspect of the medial malleoli to the midpoint of the shin and then onto the folded back portion of the previous strip, creating a belt-like mechanism. Using the belt-like mechanism and pulling from lateral to medial, apply the desired tension to pull the fibula back towards the fibular groove on the tibia. This limits lateral displacement of the fibula and lessens the stress on the structures of the syndesmosis. Repeat this for a total of 2 to 3 strips of Leukotape, ensuring to overlap the strips by half. It is important to note that the athlete may present with deltoid ligament injury or injury to the anterior talofibular ligament, the posterior talofibular ligament, or the calcaneofibular ligament because of the similarity in the range of motion that may elicit injury. Be sure to assess for involvement of these ligaments and tape for an inversion or eversion sprain on top of the syndesmosis sprain support to ensure optimal support of the ankle for the athlete. Once the support technique is complete, reassess sensation, movement, and capillary refill. Ensure that the tape is doing its intended job by recreating the mechanism of injury and asking the athlete if they feel a reduction in pain. Finally, take the athlete through sport-specific movements to test the integrity and functionality of the support technique. Some things to keep in mind when performing the support technique include ensuring that the Leukotape does not adhere to the skin. The tensile strength of this type of tape is very high and may cause injury to the skin when pulling on it. It is also important to ensure that the tape does not fully encircle the lower leg. Again, the tensile strength of this tape is strong and does not allow for much give. This may irritate the athlete during a muscular contraction of the lower leg. It may also compress the structures passing under the support technique, such as the peroneal nerve, arterial supply, peroneal tendons, and extensor tendons of the foot. Compressing these structures may cause pain, loss of sensation, or loss of motor ability of the foot and ankle.